Tuberculosis is one of the deadliest diseases in the world today, with a third of the global population infected and nearly 9 million new infections each year. Active TB most often affects the lungs, but it can also affect almost any other body organ. Dr. Copeland from Howard University Medical School is an ophthalmologist who has done extensive work in Africa. He says that one of the organs that can be affected by TB are the eyes.
It can cause all untoward effects to the eyes. It's one of the great masqueraders. It can cause your vision to go down, and it affects all parts of the eye, from the cornea to the lens to the uveal tissue and the retina.
People with TB disease will need to take several types of drugs to get rid of the bacteria in their body. Such drugs will efficiently destroy all of the bacteria and prevent them from becoming resistant to drugs.
When you see someone that you think is just positive, does not have any active, you give them a first-line drug. Individuals that have active disease, you give them second and third-line medications, and you like to start as quickly as possible. Once you make the diagnosis someone has active tuberculosis, then you want to start treatment. And treatment's up to 1 year to 2 years that you'll treat an individual.
However, when the first-line drugs are not effective in fighting TB, the patient is then prescribed a second set of drugs.
Sometimes you have to use a combination of medications because you have individuals in which you're not getting a response to the medication. It's just like anything else. You have resistance, you have different susceptibilities of medications or antibiotics to the tuberculosum. Okay. So the tuberculum is not responsive to one medication, so you use combination medications to eradicate this infection.
Dr. Copeland travels to various African countries on mission trips at least twice a year. One of the objectives of his mission, he says, is to empower local medical workers by providing them with the necessary skills to cater to the medical needs of their communities.
One thing we try to do, we try to empower the individuals when we go over to the countries. When we do surgery or we do anything over there, we take the doctors, the nurses that are there, we educate them by giving them lectures, and then we give them a practicum where they actually work with us to learn the skill transfers that we're giving them so they can be able to take over when we're going. So a mission trip with me means that I'm empowering the individuals that I'm going over to do and to see. And we've been very, very fortunate both in Ghana, in Ethiopia, and also in Egypt, that individuals are ready to learn, and they are helping their people by learning these skills to be better physicians and healthcare providers.
For Voice of America, I'm Mvunganyi.